I've had relatives reach out to me. How long do you think my patient will be spending here? And I've also had patients who come in and then ask me, how long do you think my condition would actually be on admission? And then there are also relatives who will say, how do you assess my client? Do you think my client is fit for discharge? Or how long would you recommend that my client should spend on admission? And a couple of them gives me concern, especially because it is from the financial dimension. So on this very video, we want to actually talk about those factors that would actually be put into perspective for considering the duration of hospitalization for substance abusers. And if you are yet to check those factors that determine the hospitalization of abusers, as well as those who are suffering from various forms of addiction, please try to check it up. All right. And then let's go into this very one. Those factors that will determine how long would a client spend on admission. The duration of hospitalization for substance abusers depends on various factors. There are various factors that will be put into perspective. But for better understanding, we actually group them into medical factors, psychological factors, social factors, substance specific factors, as well as treatment related factors, insurance and financial factors, hospital policies and guidelines, which are actually going to give us a better understanding to help us understand what are those things one should consider to know if a client require either a short-term hospitalization or a longer-term hospitalization. So let's go to the first one, which is the medical factors to be put into perspective. Number one, where there is severity of addiction. More severe addiction requires longer hospitalization. Where a client have a severe addiction, especially where high tolerance have set in or greater level of dependence on that particular addiction, those clients will require a longer term of hospitalization, because it is believed by certain group of theories that for some theories they believe that the brain takes 3 months to heal. Hence, 3 months should be the standard for an addiction rehabilitation. While some theorists believe that the brain takes 6 months for recovery. Hence, hospitalization should be given a standard of 6 months inpatient treatment or management for an effective outcome or for a better prognosis. So, depending on the theory, it would actually determine if a client would be hospitalized for a longer time in the sense of the severity of this addiction. All right. The second one is the presence of co-occurring medical condition, of which I've explained in the previous video, that we have what we call single diagnosis, where the client is only suffering from the substance abuse. We have what we call dual diagnosis, where the client is suffering from substance use disorder as well as other mental health condition, or the client is suffering from the substance addiction as well as a medical health related condition. So, where there is a co-occurring medical condition, patient with chronic medical condition will require a longer hospitalization. And then the third one is the aspect of complexity of withdrawal symptoms. There are persons that their withdrawal symptoms are so aggressive, and in those instances, patient with severe withdrawal symptom will require a longer hospitalization. The fourth one is the presence of medical complications. You know that most of this substance can actually set the pace for some disorders, especially medical related disorder to come up or medical related conditions. So, patients with medical complications such as liver disease, heart diseases require longer hospitalization. Even those persons who get infected with HIV through the use of IV route, which is in terms of sharing syringes, those set of persons require long-term hospitalization to be able to effectively handle the aspect of the substance as well as the medical condition. While this longer hospitalization is justifiable, so it's because they have to be one, that aspect where the client gets the detoxification, in the sense that the substance gets rid from their system, and then drug adjustment will be done, drug changes will be done to the point where they will get a comfortable medication that will lesser side effect profile for this client, as well as the dose with lesser side effect profile for this very client. All right, that will take us to the psychological factors that determine the duration of hospitalization of clients with substance addiction. The first one is severity of mental health disorders. Patients with severe mental health condition will require a longer hospitalization. I've already explained it by saying that there have to be a lot of things to be done on that client. In terms of the points where the client will gain a better judgment, the drugs would also be adjusted to fit in with the client's system. All right. The second one is cognitive impairment. Patients with severe cognitive impairment require longer hospitalization so they don't become danger or harm to themselves or other persons. And then emotional instability would be another factor to consider. So patients with severe emotional instability require longer hospitalization so they don't act like threats to themselves or to other person. History of trauma is another aspect to consider. As I said in the other video, there are patients with what we call post-traumatic stress disorder, which may come from persons who stay in a crisis-prone environment, or persons who stayed in flooded environment, or patients who have encountered wars or divorce or breakups and so on. Those flashbacks can actually prune them or make them susceptible to committing suicide or suicidal ideations. So this set of patients will require longer hospitalization. Then from the social factors, we have the first one, the aspect of support system. Patients with a stronger support system may require a shorter hospitalization, whilst those persons will reduce support network or support system will require longer hospitalization because they want to take them to that point where they are independent and there is effective observation of this client. For instance, those people who may have suicidal ideation, if they have reduced or no support system, then what do you expect? There will be no proper monitoring. Hence, they can actually attempt suicide. All right. Having understood this, the second one to consider is the home environment. Patients with unstable home environment will require longer hospitalization. I believe we can get it from earlier explanation. And then the third one is the employment status of this client. Patients with stable employment may require a shorter hospitalization. Why? Is because one, they may not give them a longer term for longer hospitalization, except where complications have set in. And two, is because one of the factors to consider is the client empowered so that they don't have those points of idleness, because idleness is another greater triggers to the use of substance. So the one to consider is the client having a stable employment. All right. Having understood that, the next one will be the aspect of family dynamics. We have said it earlier, patients with dysfunctional family dynamics will require longer hospitalization so it doesn't serve as trigger to the use of their substance, or it doesn't spur the use of their substance lifestyle. Okay. So the next factor to consider is the substance specific factor. So the first one is the type of substance the patient use. Hospitalization duration varies depending on the substance the patient uses. For instance, opiates, alcohol, and cocaine will require longer hospitalization, including the cannabis, because some of these substances are actually social drugs, whereas other ones have higher addictive rate or higher addictive effect on the client. Hence, they will require longer hospitalization. You want to ask me, what is wrong with the social drugs? Is because, for instance, alcohol, if someone is using it, nobody will go and stop them. They'll just be like, the person is just passing time, not knowing that some of them are even suffering from addiction. That's why alcohol, marijuana, nicotine, opiates, and so on, they will require, including cocaine. Although cocaine is actually a controlled drug, the cocaine aspect is because of the higher addictive rate or the higher addictive effect on the client. So these persons will require longer hospitalization so that they will get rid of this substance from their system, as well as they will get to that point where they can make better judgment. Hence, they can see the need to quit, and their will would actually be built up so that they can make that self-will to quit that substance. All right. The next one under the substance specific is the duration of substance use. So longer substance use duration will require longer hospitalization. So someone who is just starting the use within the time frame of 3 months to 1 month to 3 months, and someone who have been using for the past 10 years, 14 years, and so on, the hospitalization duration will differ in this client, because for the other person, there might even be possibility of other medical health related conditions or mental health related conditions. All right. So the next one is the frequency and amount of substance use. So higher frequency and amount of substance use will require a longer hospitalization. So someone who would use, for instance, uh, let's say pentazocine, for instance, the client is using uh, 3 ampule of it, and someone who is using 5 ampule of it 3 times a day. You see, the hospitalization will differ in this client, because the other one is using the 3 ampule a day, in the sense that using one morning, one afternoon, one evening. You can easily cut down. But someone using 3 times a day, that kind of client, one is even at that rate we will call the intoxication rate or the poisonous rate, all right? Because it can actually kill that client at that point, all right? Having understood this, you would see the need that the frequency of the use of this substance will determine the duration of the use of the substance. For instance, persons who are even abusing alcohol, they can even sleep out of the home where you don't even observe them, and they get to top up with every moment. Some may even be hiding it in different corners of the room. So the frequency has a greater role to play in the duration. Then the next factor to consider is the treatment related factor. So treatment responses is the first one we'll consider. Patient responding well to treatment may require shorter hospitalization, who have whereas those persons who have lower responsive rate will require longer hospitalization. Treatment complexity, the second one. Patient requiring complex treatment, for instance, the medical assisted treatment would require longer hospitalization, because there are other medical conditions that needs to be given attention. The third one is the relapse history. Patient with a history of relapse will require a longer hospitalization, so that they can fish out those newer triggers, or the possibility of them even using a newer substance which is completely different from the initial substance they were hospitalized for. So those people will require a longer time, so that they can wean them off those substance, and then they can be able to identify the newer triggers that have come in. And then the fourth one is the aftercare planning. Patients requiring extensive aftercare planning require a longer hospitalization. For instance, those people will reduce support system or reduce support network. Those set of persons require longer hospitalization. And those persons who have the poor home environment, or do not even have, and in terms of the homeless patient, do not have a home to stay, those people will require longer hospitalization, so that they can actually have a home for them. Or those persons whom their environment is a trigger to them, they might be need for change of environment, as well as those persons who do not even have the a better work or a stable job to do. We have said it earlier that idleness is a greater trigger for most patients to use substance. Imagine someone who have graduated for the past 5 years and have never been employed. Depression can actually make that person to actually go into substance use, just to wipe away that memory, or to get relief from those negative memory. So those set of persons, one of the things that will help them come out of the substance or aid them in their rehabilitation will be to get a stable employment for them. Hence, they need to prolong their hospitalization. The next factor to consider is the insurance and financial factor. The greater role, this one plays a greater role, because at a greater extent, if they don't have sufficient support financially, then the rehabilitation for especially the private settings, they are not free. So they need a stable financial support or backing for them to have a longer hospitalization. Hence, the financial or insurance factor play a major role for the duration of client hospitalization. So the first aspect we'll consider is the insurance coverage. Patients with comprehensive insurance coverage may require longer hospitalization, because they don't have anything to worry in terms of their financial aspect. The financial resources is the second one to consider. Patient with limited financial resource may require a shorter hospitalization. Patient with limited financial resource, those set of person will require a shorter hospitalization. The third one is the Medicaid or the Medicare coverage. What we mean is that the patient with Medicaid or Medicare coverage may require a longer hospitalization because someone is actually responsible. For instance, the HMOs, they are responsible for their hospitalization. Having understood this will take us to the next one, which is the hospital policies and the guidelines. The first one under this is the hospitalization protocols. Hospitals have varying protocols for substance abuse treatment. So we have the first one, which is the inpatient management at the emergency unit. Then they go to the short-term hospitalization, and then if there is need, there will be need for them to be uh, shifted to the long stay wards. All right. So having gotten this, it take us to the second one, which is the staff availability. Hospital staffing levels and expertise would influence the hospitalization duration. So where there are no sufficient staffing to man that particular facility, they may not want to take uh, beyond their capacity for the staffs to handle. And then in some cases, where there are no sufficient expertise, even the clients too, the relative may even want to refer their patient out or take their patient out of transfer their patient out of that particular facility. So that to a greater extent will determine the duration of hospitalization. And then the bed availability will play a major role because you can't keep your patient on the floor. So hospital bed availability affects hospitalization duration. And you know that because of this, because most clients, especially those ones that have HMO coverage, certain private facility would rather want to go for the private individuals because the HMOs may not want to pay for a prolonged period of time, while the private, those persons that are paying for their hospitalization, because they want their clients to recover, they don't mind spending as much as do we get. Hence, it will determine the hospitalization duration of this client. So, a typical hospitalization duration for substance abuse treatment would include the first one, the detoxification duration, and then the residential treatment duration, as well as the intensive outpatient treatment duration and the partial hospitalization. What do we mean by each of these? For the detoxification duration, it is believed that between 3 to 14 days that the substance should have been weaned off the system, at least to a greater degree, although it is measured by some theories for 2 weeks to 12 weeks, which is 1 month and 2 weeks. That's at that point, the metabolites of those substance should have gotten rid at least to a greater percent out of that individual system. So that is what we measure the detoxification duration. The second one is the residential treatment duration, where it is measured for 30 days, which is 1 month, to 90 days. Remember, I said that some theorists believe that the brain cell would take 3 months to 6 months for it to revitalize. Hence, what we mean is that the healing for this brain cell takes this duration. So the rehabilitation should span within this duration so that as the brain is healing, they can make proper judgment and then they can have a better cognition. All right. So this duration will determine how long the client will spend on hospitalization. And then we have the intensive outpatient treatment, which will span for 6 weeks to 12 weeks. So this is dependent on different facility. And also the degree of intensiveness would also be dependent on the type of substance, the duration of use of this substance. So some patients may require once a week, some may require twice a week, some may require once a month, some may require twice a month, and so on. But the duration spans within 6 weeks to 12 weeks for most instances. So the partial hospitalization, in the sense that the clients will come in to spend 2 weeks to 6 weeks on inpatient hospitalization, and then the rest will be outpatient hospitalization. That could be considered as the partial hospitalization. All right. Having understood this, Please note that these factors and durations are general guidelines and may vary depending on the individual circumstances and the specific treatment centers. They play a major role. So, if you have actually followed through from beginning to this point, I want to also recommend to you that I'll be making another video to check those factors that will determine the termination of hospitalization for substance users. What are those factors you should put into perspective? And then if you are here to check the clip on the factors that will determine hospitalization of substance users, please check it up to know when a client should be taken in for either outpatient or inpatient rehabilitation. So thank you so much for always checking up. At this point, I want to appreciate you for your support, and then I look forward to that very moment where this particular channel becomes your most favorite click. And if you are yet to subscribe, why not? Please subscribe and turn on all notification bell. And for now, please stay safe. Thank you.